President Trump is traveling to Arizona today to visit a Honeywell facility that is producing N95 masks. Major Garrett is following the latest from the White House and all that is coming out of D.C. So, Major, we had already heard reports that the president was getting cabin fever, like a lot of other Americans who are stuck indoors. So what's the significance of today's trip?
Well, getting out of the White House is a symbolic signal all of its own. The president hasn't done this for several weeks, and this is a long-distance trip, nearly all the way across the country, to a politically important state. You don't have to be cynical to evaluate the political importance of Arizona in the 2020 re-election campaign. President Trump won it narrowly, I think by about 3.5% in 2016. Wants to lock it down. There's also a Senate campaign there that's important to the Senate Republicans, seeking to retain control of the United States Senate. So there are some political echoes around this trip, but it's also a photo opportunity to talk about something that the president believes is one highlight of his administration's approach to expanding U.S. production of personal protective equipment, in this case, N95 masks. He's going to a Honeywell factory. This factory, up until just a few weeks ago, was producing airplane engine parts for assembly. Now it's producing N95 masks. So the photo up, here's production in America of N95 masks, part of the personal protective equipment stockpile that's now growing because of U.S. manufacturing. Of course, the sidebar question is, will the president wear one? Now, that's not just a matter of style. It's also a matter of signaling at the highest level of the U.S. government the importance of face coverings in a time of not only the economy reopening, but following the guidelines, the federal government, the Trump administration's own guidelines about how to best proceed. And one of the great questions that's going on right now, Vlad and Anne-Marie, as the country does reopen, is the number of states that are doing so quite ahead of the federal guidelines, meaning they're doing things, moving from phase 1 to phase 2 in some cases, without reaching the statistical means by which the federal government says you should do this, getting ahead, essentially, of where they are in terms of the virus spread and the number of cases in their states. So we're going to be experimenting with all this, and the projections of more cases and more deaths have to be rattling to the administration at a time when the impetus from the president and everyone around him is reopen the economy.
Well, let us speak about that, because there is a new report out with new projections, and it's based on the fact that many of these restrictions are being lifted in certain places. And as you point out, they're not necessarily following even the federal guidelines when they're lifting these restrictions. And so we're looking, at least with this projection, a significant increase in the number of cases and deaths. What can you tell us about this new projection?
So there's two that the administration has its eye on. One was the front page A1 story in the New York Times saying that there's an internal document which is based on estimates cobbled together by the Centers for Disease Control and Prevention and the Federal Emergency Management Agency. The White House said it hasn't been produced for the White House Coronavirus Task Force, but it didn't say that these numbers don't exist, are not based on anything. They just said, well, we haven't reviewed them yet, and they're not part of our internal document process. Doesn't mean they're not valid. That suggests as many as 3,000 deaths per day in the summer months. There's also data that the White House does follow very closely out of the University of Washington. We've come to know the acronym, some of us, IHME, Institute of Health Metrics and Evaluation. It also has doubled its projections of U.S. COVID-19 deaths from about 60,000 to upwards of 126 to maybe 130,000. What we see in these projections and in the president's own rhetoric of the last few days is a gradual suggestion that this is going to continue to be bad and the deaths are going to continue to rise. The president, for the very first time last Friday, said he hoped the United States would stay beneath 100,000. Then on Sunday, he said, could be 100,000, essentially ratifying that number, which follows very closely the projections of the University of Washington and that institute. All these projections suggest one thing that has been kind of consistent with the science. When you shut everything down deaths and cases and hospitalizations over time decrease. But when you open things back up and there's less social distancing and possibly less discipline about hygiene, you're going to have more cases and quite probably more deaths. And that's the space we appear to be heading toward. And the great question for everyone, for the White House especially, is as you move to reopen the economy, do you raise the risk factor? And does that risk factor become so much that there is a natural, intense tendency to pull things back? We don't know yet. We're moving in that direction, and we're all going to find out together.
Major, I guess the question that many have is, why is the President of the United States sending mixed messages? Look, everybody wants a leader who is optimistic, but is transparent to the realities of what a nation is facing. And I can understand the president revising those numbers because there's still a lot about the coronavirus that doctors are learning. And of course, you know, going back to Winston Churchill, who never promised anything but blood, tears, toil, and sweat, I get that the president is being upfront about the numbers as he is getting them. But then on the flip side, you hear him make comments about how everything's reopening and the economy is going to come roaring back and everybody's optimistic and that we're testing more than ever. And that, I mean, and those things do not line up with the facts either from our medical professionals or the agencies that are tasked, like the CDC, with providing those numbers to the president. And now we're learning that the White House is barring task force members from participating in congressional hearings without approval from the chief of staff. So I guess it's hard to figure out what the message is when you're getting two different types of messages from the commander in chief.
Right. So let's take that last point first. This lockdown on coronavirus task force officials testifying before Congress, at least testifying before the democratically controlled House of Representatives. I've seen some reporting that some may be allowed to participate in oversight hearings conducted by the Republican Senate-controlled committees, but not the democratically controlled House committees. That is to nullify House oversight and to say that this very line of questioning by nature is partisan and therefore somehow less legitimate than it ought to be. Now, that's just a political pose that's the White House is striking in the midst of all this. The explanation is, well, they're too busy to be bogged down with congressional testimony. And this is a busy time. There's no question about that. But Congress does have a legitimate oversight function. Lots of money is being spent. Lots of decisions were made, and some were not made. And it's important for the public record and the public understanding to at least have those questions posed and the administration answer them in full public view. That the White House doesn't want to do that before democratically controlled committees suggests it is somehow and at some level uneasy about that exchange. Here's the question and here's our answer. So that, I think, ought to, if not undermine confidence in administration assertions, at least allow voters to say to themselves, well, even if it's a tough partisan environment, you've dealt with that before. You believe you've made a good case. The president says over and over the response has been spectacular. There's a great success story here, even among the incredible number of cases and ever-rising number of deaths. The president says that all the time. Make that case publicly. And now that there are, and haven't been for the better part of a week and a half, daily coronavirus task force briefings, we're not seeing Dr. Deborah Birx as much, or Dr. Anthony Fauci, or some of the others. They could answer questions out. It seems like they have a little bit more time to deal with this. So the administration's sensitivity there is a signal that it's not ready to have all the tough questions asked and then answered. As for the president's optimism, he has been told almost from the very beginning of this crisis, this is a time for you to be church. And if you go back to the history of World War II, and you don't have to do all the reading, but just see a couple of movies that have been made recently about Winston Churchill in the depths of despair during World War II. Many in his own party, many in his own cabinet scoffed at his optimism, scoffed at how much he was telling Britain it would prevail when all the evidence suggested otherwise. So there is that component within the president's psyche of being optimistic and being a leader that says we can do this. And yet in a public health crisis, there are times when the public is desperate for a sense of not only facts that matter, but a sober assessment of where we are, how far it's going to be before we turn the corner, and what turning the corner is actually going to look like. And on that score, the president has been optimistic, but not necessarily specific. And there are many in the health professions who say, look, we all want a vaccine, and we know that there is a tremendous push, possibly the largest global push ever, and at the fastest rate ever for a vaccine. Just say that, Mr. President. Don't say, you know what, I'm really sure or pretty confident we're going to have one by the end of the fall or January. Because if we don't, then the public begins to get even more concerned. And there's this parallel push for therapeutics, meaning drugs that treat COVID-19. That's also working at breakneck pace. That's a positive. There's nothing negative about that. But when you're too sunny about all of those things, or those two things in particular, you may raise unrealistic expectations, and unrealistic expectations in a time of a highly contagious virus that is very deadly can create the worst of all unintended consequences.
Indeed, and an incredible amount of mistrust, I think, as well, Major. Thank you so much, Major, for breaking it all down for us.